How to recognize a heart attack and how to deal with it. A heart attack occurs when the flow of blood to the heart is blocked. The blockage is most often a buildup of fat, cholesterol, and other substances, which form a plaque in the arteries that feed the heart. Sometimes, a plaque can rupture and form a clot that blocks blood flow. The interrupted blood flow can damage or destroy part of the heart muscle. A heart attack, also called a myocardial infarction, can be fatal, but treatment has improved dramatically over the years. It's crucial to call 911 or emergency medical help if you think you might be having a heart attack. A heart attack's symptoms usually are: number 1, pressure, tightness, pain, or a squeezing or aching sensation in your chest or arms that may spread to your neck, jaw, or back. Number 2, nausea, indigestion, heartburn, or abdominal pain. Number 3, shortness of breath. Number 4, cold sweat. Number 5, fatigue. Number 6, lightheadedness or sudden dizziness. Not all people who have heart attacks have the same symptoms or have the same severity of symptoms. Some people have mild pain, others have more severe pain. Some people have no symptoms. For others, the first sign may be sudden cardiac arrest. However, the more signs and symptoms you have, the greater chance you're having a heart attack. Some heart attacks strike suddenly, but many people have warning signs and symptoms hours, days, or weeks in advance. The earliest warning might be recurrent chest pain or pressure that's triggered by activity and relieved by rest. Angina is caused by a temporary decrease in blood flow to the heart. What do you do if you or someone else may be having a heart attack? Number 1, call 911 or your local emergency number. Don't ignore or attempt to tough out the symptoms of a heart attack. If you don't have access to emergency medical services, have a neighbor or a friend drive you to the nearest hospital. Number 2, drive yourself only as a last resort and realize that it places you and others at a risk when you drive under these circumstances. Number 3, chew and swallow an aspirin, unless you are allergic to aspirin or have been told by your doctor never to take aspirin. Number 4, take nitroglycerin, if prescribed. If you think you're having a heart attack and your doctor has previously prescribed nitroglycerin for you, take it as directed. Don't take anyone else's nitroglycerin because that could put you in more danger. Number 5, begin CPR if the person is unconscious. If you're with a person who is unconscious, tell the 911 dispatcher or another emergency medical specialist. You may be advised to begin cardiopulmonary resuscitation. Number 6, if you haven't received CPR training, doctors recommend performing only chest compressions, about 100 to 120 compressions a minute. The dispatcher can instruct you in the proper procedures until help arrives. Number 7, if an automated external defibrillator (AED) is immediately available and the person is unconscious, follow the device instructions for using it. Certain factors contribute to the unwanted buildup of fatty deposits, atherosclerosis, that narrows arteries throughout your body. You can improve or eliminate many of these risk factors to reduce your chances of having a first or another heart attack. Heart attack risk factors include age. Men age 45 or older and women age 55 or older are more likely to have a heart attack than are younger women and men. Tobacco. This includes smoking and long-term exposure to secondhand smoke. High blood pressure. Over time, high blood pressure can damage arteries that lead to your heart. High blood pressure that occurs with other conditions such as obesity, high cholesterol, or diabetes increases your risk even more. High blood cholesterol or triglyceride levels. A high level of low-density lipoprotein cholesterol is more likely to narrow arteries. A high level of triglycerides, a type of blood fat related to your diet, also increases your risk of a heart attack. However, a high level of high-density lipoprotein cholesterol, aka the good cholesterol, may lower your risk. Obesity. Obesity is linked with high blood cholesterol levels, high triglyceride levels, high blood pressure, and diabetes. Losing just 10% of your body weight can lower this risk. Diabetes. Not producing enough of a hormone secreted by your pancreas or not responding to insulin properly causes your body's blood sugar levels to rise, increasing your risk of a heart attack. Metabolic Syndrome. This syndrome occurs when you have obesity, high blood pressure, and high blood sugar. Having metabolic syndrome makes you twice as likely to develop heart disease than if you don't have it. Family history of heart attacks. If your siblings, parents, or grandparents have had early heart attacks by age 55 for males and by age 65 for females, you might be at increased risk. Lack of physical activity. Being inactive contributes to high blood cholesterol levels and obesity. People who exercise regularly have better heart health, including lower blood pressure. Stress. You might respond to stress in ways that can increase your risk of a heart attack. Illicit drug use. Using stimulant drugs such as cocaine or amphetamines can trigger a spasm of your coronary arteries that can cause a heart attack. A history of preeclampsia. This condition causes high blood pressure during pregnancy and increases the lifetime risk of heart disease. An autoimmune condition. Having a condition such as rheumatoid arthritis or lupus can increase your risk of a heart attack. Complications. Complications are often related to the damage done to your heart during a heart attack, which can lead to abnormal heart rhythms. Electrical short circuits can develop, resulting in abnormal heart rhythms, some of which can be serious and may lead to death. Heart failure. A heart attack might damage so much heart tissue that the remaining heart muscle can't pump enough blood out of your heart. Heart failure can be temporary, or it can be a chronic condition resulting from extensive and permanent damage to your heart. Sudden cardiac arrest. Without warning, your heart stops due to an electrical disturbance that causes an abnormal heart rhythm. Heart attacks increase the risk of sudden cardiac arrest, which can cause death without immediate treatment. Prevention. It's never too late to take steps to prevent a heart attack, even if you've already had one. Here are ways to prevent a heart attack. Medications. Taking medications can reduce your risk of subsequent heart attack and help your damaged heart function better. Continue to take what your doctor prescribes and ask your doctor how often you need to be monitored. Lifestyle factors. You know the drill. Maintain a healthy weight with a heart-healthy diet. Don't smoke, exercise regularly, manage stress, and control conditions that can lead to a heart attack, such as high blood pressure, high cholesterol, and diabetes.